Hi everyone, this is Dr. Jay Mehta here. Hi guys, Dr. Jay Mehta here. This is our first session on this wonderful topic of ovarian cortex cryopreservation. Now, what is important for each and every person as a patient as well as a doctor to understand and remember that for a prolonged period of time, this was considered to be basically a non-therapeutic or an experimental procedure. Only very recently, ovarian cortex cryopreservation has now been included as a list of therapeutic procedures. This is something which is extremely beneficial and important for each and every one of us to understand. There were a lot of challenges as far as slow freezing of this entire tissue is concerned. There were a lot of challenges as far as vitrification of the ovarian cortex was concerned. And so far, we have reported more than 200 live births across the world and multiple ongoing pregnancies. All this while, ovarian cortex was predominantly reserved for patients who are undergoing any form of oncological procedures. That means malignancy procedures where there is no time to do oocyte stimulation. Now remember, when we try to do egg freezing, in egg freezing, what we are trying to extract from the ovary is a mature oocyte. Freezing of the mature oocyte and freezing of the ovarian cortex are completely different things. Completely different. They've got no correlation to one another. When we want to try and freeze an oocyte, the protocol for freezing, that means vitrification, is absolutely standardized. There is no problem in that, right? It's a very, very straightforward procedure. The success rate after doing ovarian banking or egg banking basically is in the tune of 85 to 90%. The problem with the cortex and the advantage with the cortex is that when you try to freeze the ovarian cortex, basically you are freezing the primordial follicles. The primordial follicles are extremely tiny compared to the oocyte. The oocyte is, let's say, around 135, 140 microns. The primordial follicles are around 35 microns. These guys are simply surrounded by a basement membrane. They are not dependent on any hormones. And this is the reason why there were a lot of challenges. Of course, it has its advantages because instead of getting only 10 to 12 eggs in an ovarian cortex, one slice, that means 4 millimeters by around 2 millimeters by 1 millimeter slice of the cortex will give you close to 25, 30,000 primordial follicles if the cortex has been harvested correctly. Now that is a massive advantage. Slowly, as the technology advances, we are very certain that the world will move in the direction of ovarian cortex cryopreservation. Now, when we started this procedure, we've already done a lot of these procedures now, ever since it became a therapeutic procedure. And our experience has been that you really need to identify the cortex very nicely. You need to slice the cortex. So we have an automatic slicer to slice the cortex, and then you need to cryopreserve with the help of vitrification. That was the other challenge. But remember, now such vitrification media is available across the world. And when you have a vitrification media available across the world, this process becomes slightly more easier. Of course, it requires a lot of technical expertise. It requires a lot of dedication as far as the functional laboratory in the IVF room and everything is concerned. It requires a dedicated embryology unit. It does require us to have multiple things, right? With all this in mind, we are going to be now breaking this topic down chapter by chapter, and we are going to come up with multiple sessions so that each and every one of you can get basic information, help counsel your patients. And if you are a patient, this is going to give you some phenomenal information as far as how this entire procedure can be a benefit to you, even if you are a cancer patient or even if you are a patient who is having recurrent endometriosis and low AMH. Of course, the horizons of application of this is just going to become broader and broader, right? I'm very happy to introduce this procedure. Probably we are one of the first few units to do this across the country, and definitely we are the first unit to do it at such a large scale. There is absolutely nobody else who would be doing it at such a large scale from our knowledge, because the majority amount of media across the country is being imported by us, right? So I'll be very happy to answer your questions, and you can continuously join us for these live sessions where we are going to be updating each and every one of you about the techniques, the mechanism, outputs, and the success rate of this wonderful procedure of ovarian cortex cryopreservation. Okay, I shall be happy to answer your questions if there are any, and thank you so much.